We have another question for you that's come in. Can you tell us what types of properties were the target of tobacco-free policies in Oregon? Were they all residential properties or government-subsidized housing?
So there's a number of different things that are actually happening in Oregon. Since we passed our Clean Indoor Air Law, and that went into effect in 2009, we really started looking at other places where people live and work and play and go to school. So we do have some initiatives that are happening through our local public health authorities around public multi-unit housing. We have initiatives going on around community colleges and tobacco-free community college or smoke-free community college campuses and universities. And then particularly for the addictions and mental health part of the project, or tobacco freedom, there was an effort to take residential treatment facilities that are owned, operated, receiving resources and funds from the state, and taking those tobacco and smoke-free. But this last summer, in addition to this work that was happening in some very specific facilities and efforts, this past summer, our governor, Governor Kitzhaber, signed an executive order to take most of state agency properties tobacco-free in a phased-in approach, kind of in a gradual implementation over the next couple years. And that has been instrumental in really demonstrating and leading our state and the importance of creating tobacco-free places where we live, work, play, and learn. So it was kind of gradual, and a lot of these particular projects play on each other to support the movement and change the social norm.
Great, thank you. And now we have a question that I'd like both Dr. Coe and Dr. McAfee to answer. It has to do with FDA's new authority. And now that FDA has the authority to regulate tobacco, does this mean that we are on the way to ending the tobacco use epidemic?
Well, we're in a very exciting chapter of public health right now, and this stems back to recommendations from an Institute of Medicine report in 2007 that was looking from a broad perspective on how to end the epidemic. And they suggested a two-pronged approach. One was to advance regulation of tobacco marketing, distribution, and product design. And the other one, of course, was to maximize the use of proven interventions for tobacco control. So when the President signed the Family Smoking Prevention and Tobacco Control Act into law on June 22, 2009, he gave the FDA unique and unprecedented authority to regulate tobacco for the first time. So that's a major advance. And the other advance was to implement proven interventions, and that's where I'd like Dr. McAfee to make some comments.
Great. Thank you. Thank you very much, Howard. And I think that I actually have a slide that if you can call up about New York State's experience, if you got it there. And what this shows, I think, is the importance in terms of comprehensive tobacco control activities that we have the power to accelerate the declines that we've seen if we do a relatively straightforward series of interventions. And this slide shows the blue line with the diamonds is adult prevalence in New York City, and the yellowish line with squares is adolescent prevalence. And what you see is basically that up until the early 2000s, New York was just tootling along, flatlining basically. And then they did a series of interventions that ranged of aggressive interventions relating to very large city and state tax increases, very strong smoke-free policies, a very strong local media campaign as well as some state media campaigns, and then additional taxes in the end of the decade. And we see both basically a 50% decline in cigarette smoking amongst adults and more than cutting in half youth smoking rates. So the important message from this is it's actually very similar, I think, to the message that we heard so well from Kirsten's presentation about the efforts in Oregon. It's that whether it's done at a municipal level or a state level or even at a federal level, taking a comprehensive approach with these, particularly the 3 or 4 levers that we know work: increasing price, comprehensive clean indoor air, mass media, and then efforts to improve access to help quitting, and done with attention to disparities in the population. That when we have done this sort of thing, we see dramatic results relatively quickly. And this ties in with FDA because actually it is the more we are successful and the more we continue to leverage these activities, the more realistic it is for FDA to be able to exercise its authority. Part of why Congress was able to pass the Family Smoking Prevention Act had to do with the fact that we had been able to drive down prevalence and initiation so well over the previous 2 decades, and had really educated the American people about the importance of tobacco. And I just wanted to add one other point to Dr. Koh's summary relating to the Affordable Care Act, which is that the other thing that the Affordable Care Act has done is that it has set aside dollars for prevention specifically. And just one example within tobacco has been that we at CDC have been able to run the first ever highly successful national mass media campaign, Tips from Former Smokers, to help educate the American people. And this would have been much harder to pull off without the support that was embedded in the structure of the Affordable Care Act.